Syncope, otherwise known as fainting, is the sudden brief loss of consciousness caused by diminished blood flow to our brain that occurs at least once in about 1 in 5 people, and about 1 in 10 may happen over and over, responsible for millions of emergency room visits and hospitalizations. Though sometimes fainting can be caused by heart problems, most often it's triggered just by standing, because blood pools in our legs, or strong emotions, and are called vasovagal reactions. Under certain circumstances, such as blood donation, syncope has important medical and societal significance. More than 150,000 people experience fainting spells or near fainting spells each year when they're giving blood, so it'd be good to find a way to avoid it. But if you think that has medical and societal significance, what about fainting when you're driving? It goes without saying that losing consciousness while driving can pose a serious threat to the patient and society. Of a group of folks getting tested for it, 9% report that they had lost consciousness while driving. When it happens over and over, drugs and surgery are used, installing a pacemaker, but such therapy is expensive, efficacy is questionable, and adverse effects are common. In fact, results of most drug treatment trials have been disappointing, and the value of implanting pacemakers has been repeatedly questioned, and now there's evidence for their lack of effectiveness. So what do we do? Well, in Italy, evidently the older generation of general practitioners advised patients prone to fainting carry a wooden egg, used in the old days for darning socks, and to apply muscle tension by gripping the wooden egg forcefully as soon as a faint was imminent. These folklore stories inspired an Italian cardiologist to apply arm muscle tensing to combat vasovagal fainting, but it wasn't put to the test until now. About a minute before losing consciousness, most about to faint experience so-called prodromal symptoms. They feel dizzy, queasy, or break out in a sweat, signaling they're just about to black out. When that happens, there are a number of maneuvers shown to successfully abort the impending episode. One is called isometric arm counterpressure, where you grip one hand in the other and exert pressure trying to pull your arms apart, and you keep it up until the symptoms go away. How successful is it? Patients were shown how to do it and reported it was successful